Hello, everybody. Wishing you all a very meaningful and empowering International Women's Day. Women have many inherent strengths. They are known for their resilience and tenacity. However, along with this blessing, there are some disorders which are unique to women. Two such disorders are ovarian cyst and PCOS. 20% of women are suffering from PCOS worldwide, and 7% of women are suffering from ovarian cysts worldwide nowadays. So the numbers are quite high. It means in PCOS, out of 5 women, one is suffering from this disease. So I have chosen to speak about it as an Ayurvedic practitioner so as to increase its awareness and bust some myths. First is PCOS. You can see in the diagram, there are cysts present, a hormonal disorder causing enlarged ovaries with small cysts at the outer edge. Next slide. Signs and symptoms of PCOS: irregular menses, pimples, dryness of skin, or even the skin color is darkened if you are suffering from PCOS. There is a hair loss, facial hair growth on your face. You can feel tired and lethargic, and depression is there. Next. Conditions that causes PCOS. Nowadays, women are multitasking. They are doing so many things at the same time. So there is a lot of stress on different levels. Next is obesity. Our lifestyle is sedentary. There is a lack of exercise. So obesity is there. Mostly the fat around the pelvic area, lower abdomen, is more. Then irregular meal times. We sometimes we skip our meals, or we are rushing, always running. So irregular meal times, this is one of the cause. Overeating or hyperphagia. Nowadays, outdoor food we are eating in spite of homemade food. We prefer outdoor food. So definitely we do overeating as it is tasty and delicious. Insulin resistance. Genes means it's genetic also, there is a reason behind it. And insomnia. If you are not sleeping properly, your sleeping hours are less, there is a lack of sleep, lack of rest, it also causes PCOS. Next slide.
Uh, Thank you.
Next is ovarian cyst. An ovarian cyst is a semi-solid and fluid-filled sac between the ovary. Next slide. Signs and symptoms of ovarian cyst. Am I audible?
Yes, you are audible.
No, just now she said that there is a network issue. Okay, I'll continue. So signs and symptoms of ovarian cyst: uterine bleeding, frequent urination, nausea, pulling or aching pain in the lower abdomen. Then you feel tremendous weakness, menstrual disorder, irregular menses, again uterine bleeding, heavy uterine bleeding, tenderness of mammary glands or breast tenderness you can feel, and increased abdominal volume. You feel heaviness in the lower abdomen. Next. Conditions that causes ovarian cyst. First is endometriosis, and the second is polycystic ovarian syndrome. If you are suffering from PCOS, definitely in future, if you did not treat this syndrome, there are chances to get ovarian cyst. Next. Types of ovarian cyst. There are two types of ovarian cysts. First is functional ovarian cyst, and second is pathological ovarian cyst. Functional ovarian cyst that develops as a part of menstrual cycle, and this is normal. Usually, they are harmless, and these are most common type of ovarian cyst, and they dissolve or subside after the menses. Pathological ovarian cyst, these cysts are occurred in the abdomen due to cell growth, and these are very we have to treat them, otherwise they are causing further complications. Next, difference between ovarian cyst and PCOS. Both are, the common thing is both are growths in the female reproductive organ, and these are both are benign tumors. But the main difference is ovarian cysts are usually they appear in the uterus, and ovarian cysts they are bigger in size. In spite of that, PCOS are multiple cysts suddenly appear in ovaries. Second main difference is in ovarian cyst, person is having hormonal imbalance, so that estrogen levels are increased in ovarian cyst. And in PCOS, this is also hormonal condition, but in this, the androgen levels, that is a male hormone, is increased in female body, so that we can see the facial hair growth in PCOS, but we don't see this in ovarian cyst. And PCOS leads to ovarian cyst because whenever PCOS they develop cysts, and these cysts are affecting ovaries' ability to develop and release the eggs. The eggs are stuck in the ovaries. They're not releasing the eggs, and this causes the increased level of estrogen. And once your estrogen level is increased, it leads to the ovarian cyst. Okay, next. Treatment. Okay, now we will look the treatment of both diseases. According to modern science, they're giving hormonal treatment. That birth control pills they are giving in both diseases. And if the size is big, the fibroid size is bigger, then they prefer surgery. There is a removal of these fibroids, and there are two types: laparoscopy or laparotomy surgeries they are doing. Now we will look. We will discuss treatment of, with the help of Ayurveda. According to Ayurveda, our body has made up of the three constituents: Vata, Pitta, and Kapha. So we call them Tridosha. Vata means it is made up of air and ether, means space. Vata's nature is dry, cold, and rough. In PCOS and ovarian cyst, in both of these conditions, Vata dosha is increased and disturbed. That is why we have to treat Vata dosha. Charakacharya told 20 types of female reproductive diseases. We call them yoni vapit. Out of this, one is Shandhi yoni. So there is one shloka. Vichadoshattu garbhashayasta marutopahitashaya drudve pinyastani chaiva Shandhi syad anupakrama. So PCOS and ovarian cyst both comes under this yoni vapit. And as a treatment part, to prevent this, these both are lifestyle disorders. So first we have to improve and change our lifestyle. I will tell you some lifestyle changes for this both diseases. So first we have to avoid, or what you can avoid from your day-to-day life. First, avoid stress. Try to avoid. It is very difficult to avoid stress, but we have to do that. Avoid stress, avoid overeating, avoid overexertion or starvation or frequent traveling. These are the reasons that Vata dosha is increasing in our body. Avoid dry food For example, bakery products, avoid junk food. There are certain categories of food which do not go well together. If we eat them together, we should avoid this eating combination because they can cause diseases. For example, meat and milk, fruits and milk. So we should avoid that. Then avoid high calorie food or processed food. Nowadays, everyone is consuming processed food and they have a lot of chemicals and preservatives in it. Try to eat fresh food, homemade and freshly cooked food. As a part of good lifestyle habits, we should have our last meal 2 hours before going to bed. Go early to bed and get up early. Everyone knows this. And every day you have to do exercise. For example, 30 minutes brisk walk you can do, or 30 minutes yoga, pranayam, and meditation. It will definitely help. Here are some list of yogasanas. I'm telling you, if you are suffering from PCOS or ovarian cyst, you can still do this poses. Cobra pose, boat pose, bow and arrow pose, wind relieving pose, butterfly, and back bending pose. These are very helpful in PCOS as well as in ovarian cysts, that means fibroids. In the morning, you can drink moon charged water. 28 days cycle of moon and 28 days menstrual cycle of women are related to each other. So I'll tell you how to prepare the moon charged water. Just before going to bed, keep a glass bottle full of water in the moonlight, and in the morning, you can drink 1 glass of water, moon charged water. Definitely, it will help you. Also, you can do massage your body with sesame oil. As I told you earlier, it will reduces vata dosha in your body, as well as eat organic food, vegetables or grains. Prefer organic, sendriya we can call it, so that they don't use pesticides while they grow these grains and vegetables. So these are good for our health, as well as you can eat A2 cow ghee in your diet. As due to ovarian cysts and PCOS, women's body get internally dry. The body is become dry due to increased vata dosha. So ghee provides much needed lubrication. It helps for abhyantar snehan, we call in Ayurveda. So it lubricates our body and it controls vata dosha. Take rest during the menses. Nowadays, we can see in the advertisement that wearing a sanitary pad and they are playing and dancing and jumping. So no need to do this. For 4 to 5 days, just avoid brisk exercises and try to take rest. It will definitely help to avoid PCOS and ovarian cysts. Remaining 25 days, you can do whatever you want, but the 5 days rest is must according to Ayurveda. Ayurveda has various panchakarma therapies to treat this disease. And main treatment is basti, or we call it medicated oil enema. So it cures PCOS and ovarian cyst. I have many patients in my clinic that they are cured with the panchakarma treatments, as well as we give some medicines, internal medicines also. According to the body type of the patient, treatment is different. But in panchakarma, we can do basti treatment, enema treatment, followed by Vaman, Virechan, Nasya. Also, we in these patients, we prefer Shirodhara, which is a very good solution for stress relief. And according to your body type, doctors will decide actually what treatments we can give. As a key takeaway from today's talk, I would like you to understand that disorders are preventable as well as curable. Thank you.